Hello, my name's Neill Hepburn. I'm the Medical Director at the United Lincolnshire Hospitals NHS Trust. I've been the Medical Director for about 18 months, and before that I was the Deputy Medical Director for 5 years. I've had a very privileged career, and in fact I enjoy a very privileged time. I started as a medical student at St Andrews and then went to Manchester, and I was fortunate to obtain an army scholarship through university. So after house jobs I went to the army, and I undertook general duties as a regimental doctor with a transport regiment and then with the Grenadier Guards serving in Northern Ireland. I was then able to start dermatology, which has been my main love really. Dermatology is a superb way of earning your living, and I had to train as a physician, as getting the membership, and then do specialist dermatology training. That was interrupted actually for about 6 months when I went off at the very start of the Gulf War to Saudi Arabia to set up a small reception medical service. As the troops deployed, that became a large field hospital where I was responsible for setting up casualty management, particularly for chemical casualties, something fortunately we didn't need. It was an exciting time, and perhaps one of the biggest challenges. And that showed me how important coordination and management was. So when I returned from the Gulf War, I went to Edinburgh to the Royal Infirmary on a secondment to do specialist training in dermatology, which was a great joy. I did some research on a tropical illness called leishmaniasis. But I remembered what I'd learnt in the Gulf War, and after that I went to Army Staff College, where I learnt about effectively military management, and from there to command a small medical unit, which in fact we deployed to Angola at one point on a United Nations mission. So as the Army Medical Services contracted, I left the Army and came to Lincolnshire in 1997 as a consultant dermatologist. We then had the challenge of creating the hub and spoke dermatology service. It's been somewhat fragile before that, and I enjoyed that. I enjoyed clinical practice, apart from the odd management job as a clinical director, but mainly clinical practice for about 15 years. And again, rather like the experience I had with the Gulf War, I felt a little bit frustrated that the difference I could make as a clinician was limited as an individual clinician. So I did an MBA and then became the Deputy Medical Director. And I'm now very fortunate working with a whole team of people. I carry on doing dermatology. I do a clinic on a Wednesday afternoon. I do a surgery list on a Friday afternoon. So I still maintain that clinical base, but I'm able to work on clinical strategy of sorting out how the clinical services can be provided in the contracting and funding available in real terms in the health service, how we can reorganise ourselves so that we have a system that provides good career opportunities, it's enjoyable, it's satisfying, and most of all we provide the care that is needed for people who live in Lincolnshire. I'm obviously concerned about the quality of care, and a large part of the job is looking at professional standards, looking after doctors to make sure that they are properly trained, they maintain their training, they're able to demonstrate that they're up to date and they're fit for practice, and investigating and learning from events when things don't go so well. All clinicians know, and in fact everybody knows, that from time to time things don't go as well as we hoped. And the key bit is to learn from that. I've made many mistakes, I continue to make mistakes, and the crucial thing is to learn and to work in an environment where we're supported to do that. So that's a big bit of the work, and it's a satisfying bit to help us evolve to becoming a truly safe, high-performing organisation. So in conclusion, I've had a career that's encompasses both clinical work, which is, I would say, is my prime function, my prime enjoyment, but I've also been able to enjoy a management side which has broadened the scope for learning and for helping and broadening the groups of people I work with. So I can look back on the time I've spent and and feel I've been very privileged and very lucky to do that.